Thank you very much for honoring this invitation. It's a real pleasure. I'm really honored to have you join us. So today we'll be discussing about one pertinent topic, which is on inventory and supply chain in the laboratory, right? You are a professional, you work with the Nigerian Family Healthcare Society, and I believe working as a supply chain manager for that particular organization gives you a fit for this particular topic to share with us how you handle the supplies for this particular organization and which can help us to navigate through supply chain and inventory in the laboratory. So that's what we'll be discussing on today, supply chain and inventory in the laboratory. So thank you very much for joining us.
Thank you, Kevin. Nice meeting you.
Yeah.
Nice talking to LabTalk.
Yeah, a LabTalk. So it's an initiative that we started to share knowledge with younger laboratory professional and professional in the field. Because throughout my career from the start to present, I discovered this gap in knowledge that younger professionals have because what we are being taught in school doesn't reflect what we see on the field. So that's why this initiative was birthed to actually reduce this gap in knowledge and what we expect in the field in terms of practice when it comes to the laboratory. So we have other goals and objectives. We are looking forward to, in the long run, establishing a consultancy firm to help train personnel to achieve the accreditation to ensure that laboratories deliver quality results to their communities.
That's impressive. Well done.
Wow.
And best of luck.
Thank you very much, sir. So, just right on in today's session, we're not going to be too long. So, I would like you to give us more detail about yourself. Who is Mr. Ahmed, and what was the journey like? How is it going, and what's the vision for the future? If you permit us to share what you are doing at the moment and where you are heading to in terms of project and activities.
Okay. Thank you, Kevin. It's nice talking to LabTalk. So, before I introduce myself, I would like to give feedback uh, on your initial comments. You see, there's knowledge and practice gap between what you learn in school and what you meet out there as a laboratory scientist. And actually, you are right because you see, when it comes to inventory management, supply chain, uh, I think it favors pharmacists more. Pharmacists play better role. However, when it comes to public health, you see that laboratory commodities are also very significant. So, for us to actually encourage young laboratory scientists to have interest in supply chain and inventory management, we have to show them the data and the gap and why they should actually venture into inventory management. However, in public health programs, for instance, in HIV, you have both pharmacy commodity and lab commodity test kit, CD4, VCTech, determine, and the rest. And you see that out of stock of this is not even acceptable. It's very important. It's only when you have accurate diagnosis that you're going to have better treatment and adherence, and also zero viral load. So you engaging in this, and I think this is very important. And I hope this will actually motivate young laboratory scientists to also see themselves as also commodity persons and inventory experts, not only laboratory persons. Because if you focus more on the laboratory services and you don't understand how the commodity reaches to you, I think it's not going to help the system. We have to learn to study the pipeline and study our services and ensure there's uninterrupted supply of commodity across our program, from manufacturer to the service delivery points. So then let me introduce myself. Sorry for taking time. trying to give them. I know there's time for better discussions, but I don't want to forget the main point. That's actually a very important point. Lab scientists can also be inventory expert and supply chain personnel as well. Even though there are few lab scientists that are venturing into that, we need to encourage more to actually motivate them to actually go deeper into inventory management. So my name is Ahmed Haruna Danjauma. I'm a pharmacist by profession and a public health supply chain specialist with over 12 years of experience in HIV, TB, malaria, MNCH, nutrition, family planning, laboratory and essential medicine supply in Nigeria. I also have little experience working in part of Niger and Ghana. I work with Zipline Medical Drone Delivery in Ghana in making sure medication and commodity reach those people that really need them. This medication and commodities include both pharmacy and laboratory commodities, test kits, and the rest. So I also support in strengthening supply chain systems across Nigeria and some West African countries. I also support inventory management, forecasting, quality improvement across health facilities. So I also do support in design of inventory management dashboards to ensure there's end-to-end visibility in stock level across facility and across managerial unit. So this is short introduction of myself. Thank you.
Thank you very much for that introduction. I'm really impressed by the introduction you just made, and that gives me the motivation to actually push forward to actually improve this podcast session so that professionals can really understand how the inventory and supply chain system works. Because I myself, as a quality assurance mentor, where we mentor facilities that basically deal with HIV testing and all of that. So the issue of supply chain is actually a big challenge, right? So it's a big challenge to those facilities. And to mitigate that, these people need to understand how it works. Because a patient gets into a facility and you tell him that there's a stock out of reagents, it's not actually a good thing for a patient to hear. So that's why I had to invite a specialist just like you are to tell us about how these systems work. So thank you very much for that. And I would like to go ahead to ask our first question for the day is on, from your vast experience, how will you define or frame the concept of inventory and supply chain management in a context of a healthcare system?
Thank you very much. When you say supply chain is a bigger umbrella. Yeah, it's a bigger umbrella. Inside supply chain, you have logistics, you have inventory management, you have warehousing, you have distribution. Supply chain also involve forecasting, procurement, stakeholders engagement, uh, manufacturer analysis, and the rest. So supply chain is a bigger umbrella that contains some stuff of 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 activities. I don't know if you get me. So inventory management is ensuring the right commodities are available at the right quantity, at the right place, at the right time. So inventory, when you say inventory, another word for inventory is stock. So it's like managing your stock, making sure you manage appropriate level of stock at certain place at certain time to minimize, to avoid out of stock while minimizing wastage. That is inventory management. So you manage your in and out of commodity, manage expiries, manage stock out, manage wastage. So that is inventory management. That's why inventory management you normally use tools, inventory management tools. Like we have Open LMIS, you have the M Supply that is used in our warehouses. They are used in inventory and warehouse management. You understand? So inventory management and warehouse management, they exist along each other. So when you are managing inventory in the warehouse, so you do once you manage inventory, you also manage the warehouse as well. But when you talk about supply chain, is entire process from forecasting to procurement to storage to distribution and use by the patient. So you can see, as I said earlier, supply chain is like a bigger umbrella, why it contains both inventory management, warehousing, distribution, and the rest. Why I can say inventory management is just a subset of supply chain management. I don't know if I have answered your question very well.
Thank you very much for that. Yeah, the question is well understood. The answer is well understood. Yeah, the concept of having a supply chain as a bigger umbrella with other specific activities that are being carried out under that bigger umbrella. And you've defined it right. I would say the aspect of inventory are like you define, managing of stock so that the facility has enough and minimizing waste. Because it's true, if the stocks are not well managed, there'll be a lot of waste, especially when it comes to test strip, for example, right? If you have excess of it, the strips
Yes,
might go expired without you even using them. So when it comes
yes.
to like what you define on inventory management, having defined this aspect of inventory management in healthcare facilities, uh, talking about the importance of these systems well established in the facility, how important is it? Because in facilities, I've come across facilities where they have this great challenge of inventory management. What is the importance of a good stock management and inventory in the facility on the patient, on the staff, and the facility at large? How important is it?
So
What
what
can
I'm
you?
saying is that laboratories depend on uninterrupted supply of reagents,
Mhm.
test kits, and consumables. So
Yeah,
poor inventory management can lead to out of stock. When you have out of stock, you have delay in diagnosis, you have inaccurate result. Yeah,
mhm.
sometimes some people can cook result out if they don't have the reagent for a certain test,
Yeah,
just for
that's
them to
true.
meet demand. And there will be interruption of services. So a client come to you, you don't have HIV test kit. So that service has been interrupted and you might not see that client again. And sometimes people tend to use some reagent in place of some reagents. This can lead to inaccurate result and it can increase operational costs. Just like I say, someone using first line, second test kit, or HIV test
Mhm.
kit in place of first line, or second line in place of first line. So you can increase operational costs,
Mhm.
maybe by also placing emergency supply. Normally, you buy this test kit, let's say five naira, but you run out of stock. For you to go and get it emergency from a nearby stock, you have to pay higher amounts, and this cost is beared by the client most of the times. So you can see how inventory management is very important and supply chain. Let
Yeah.
me let me give close with a key message here. A strong supply chain and inventory management save life because
Wow.
patients
True.
cannot receive quality healthcare without essential medicines and laboratory commodities.
Mhm.
So a good supply chain and inventory management system save lives. It saves life. Let's look at it as if we go out of stock, we are going to lose life. Compare out of stock with life saves or life waste. So that's when we're going to know the importance of inventory management and supply chain system in our public healthcare services. Thank you.
Thank you very much for that. Thank you. When you mentioned the importance of stock management and inventory management on saving lives, that becomes very, very critical because, like we explained, if you are out of stock and you need to maybe diagnose a patient urgently, what happens to that particular patient at that time? And you lose a lot of lives and patients to just stock out, which is very, very important to pay
Yeah.
attention to such points.
Let's assume you have a blood transfusion, an emergency blood transfusion.
Yeah,
A woman has given birth and she's losing blood, and you don't have reagent to actually screen the blood that is
yeah,
going to be transfused.
yeah.
So you can see his waste of time can cause like someone lost blood, a lot of things actually.
Mhm. That's true. And what you are just explaining is something that I've really come in face with so often. There are some point I wonder if some of these personnel are trained because that's the essence of lab talk. Because when you get to some facilities that are like kind of blank when they talk about inventory management, how do they reconcile their stocks, how do they receive, how do they manage their stock, and how do they buy or use their stock. So it's a very critical point when it comes to saving lives, right? When we're talking about pregnant women receiving blood or during surgeries, it becomes more and more critical. So that leads me to the next question on uh, what are the two most important causes of stock out and stock shortages in laboratories or healthcare services?
So one of the cause of stock out is poor forecasting. So you have to forecast your need
Mhm.
based on your population and your facility and the service you provided.
Yeah.
Forecasting can be done annually, biannually, or quarterly
Mhm.
based on your procurement cycle. So there's poor forecasting. People tend to under forecast or over forecast. And when
Mhm.
you're forecasting, you have to make space for buffer, emergencies, and the rest. So,
Mhm.
and when people forecast poorly, you don't blame them because they don't actually have data to support them in forecasting. When forecasting, we need consumption data, we need service data to actually support us in forecasting. So if you don't have this data in the facility, your forecasting will be poor. You have a very poor forecasting. So that is one. Then maybe another reason is poor reporting. Basically, like in areas of in Nigeria, you have to send your report bi-monthly before you get your supplies. So if you don't send your report, they wouldn't know what you consume and what you have on ground, and they wouldn't prepare your supplies, your LMD. We call it last mile distribution. So
Mhm.
late submission of report also lead to stock out. Then another cause of stock out may be delay in procurement. So you experience that your stock level is going down and you didn't notify the management, so they will make arrangement for possible procurement. And sometimes when you place order for procurement, it takes time before it arrives your facility. So we
Mhm.
don't even want emergency procurement. We want to have system on ground whereby there are a lot of commodities available to carry out to help us support us carry out all our activities. Then maybe poor storage.
Yeah.
Sometimes they don't store commodity very well and they get damaged. Yes, commodities tend to get damaged and they are not usable. So they are not being stored appropriately. Then lastly, what I want to add is when you have poor storage, it causes out of stock or by damage. Then sometimes you have expired commodity. You don't monitor your commodities very well. That's why you need an inventory management software or tool. This will help you monitor your inventory. When commodities are about 6 months to expire, it's going to alert you by sending you text messages or making
Wow.
some noise. Then you now check and see, okay, so commodities is about to expire. You now carry out actions. Either you increase their consumption or you distribute them to areas where they are being needed. And also maybe sometimes there's increase in demand.
Mhm.
Unexpected increase in demand can also lead to out of stock. Let's say you have some refugees coming into the society and you just have little malaria test kit that will cater for only your community, and you just have influx of 10,000 people to your community, and they come out with malaria and you have to use what you have to test them. So
Mhm.
what you do when you have increase in demand. Immediately you suspect an increase in demand, you raise an alarm and you seek for support. So you don't wait until you go out of stock. You already know
Mhm.
there are influx of. That's why it's good you share information. There's information sharing between partners and stakeholders. So when you share information, you actually understand the system and you understand whether there will be influx or outflux of people from the population. So these are a few causes of stock out that I can list for now. Thank
Wow.
you.
Thank you very much. This is being very detailed. I particularly love the point of forecasting, right? Uh, for the sake of our audience, I don't know if you can go more detailedly about forecasting, how it's been done, and how is it being implemented in laboratories, right? I'm sure some people may know have come across the term forecasting, what's it all about. So I would like you to go maybe more in depth about this particular term and thematics.
So thank you. Forecasting is like you trying to put down what you need for a certain period of time
Mm-hmm.
for the future.
Yeah.
Yes. So that you place order for them and you get them. So forecasting is like trying to estimate the quantity of commodity needed to cover for a certain period of time.
Mm-hmm.
That is forecasting. You
Yeah.
see, a small error in forecasting is it's basically calculation. You even use
Mm-hmm.
statistics and use some formulas to actually get it right. And for you to forecast, you need a lot of information. You need consumption, past consumption data, you need past service data. For HIV, you need HIV prevalence, then the population of a certain community. It will help you to forecast the number of test kits you needed you need for first line, for second line, or for tiebreaker. You understand? So
Mm-hmm.
forecasting is very important and is a technical area in supply chain. So experts are needed, and a lot of experts come together both from the clinical, from the financial, and from the management team of
Mm-hmm.
public health setting. They come together to make decisions on forecasting. So after forecasting, quantification go further to add also the cost of individual commodities. You understand? So quantification and
Yeah.
forecasting go hand in hand. However, quantification is like a bigger umbrella. It's like a bigger umbrella. Quantification is like a bigger umbrella.
Mm-hmm.
While forecasting comes inside. So forecasting is like a subset of quantification. So quantification is like a more technical what you need. But
Mm-hmm.
quantification is like you actually go deeper in making sure you know the cost, and you actually place some order, and you actually start doing what we call supply planning. Is that okay?
Oh, thank you very much for that. Thank you very much. That's well understood. I believe we are going to take more advantage of this particular explanation that you have given. Uh,
Yeah.
this really very important and vital
You
information.
can read deeper.
Yeah, yeah. You can go ahead, sir.
Forecasting is like trying to estimate the quantity of commodity that we needed to cover a certain period of time.
Mm-hmm.
Quantification entails both knowing the quantity and also estimating the cost.
Wow.
So forecasting is part of quantification. That's
Yeah.
basically what I want to say.
That
So
yeah.
please go ahead. I'm done.
That's quantification basically inclined more into budgeting, right?
Yes, yes.
Thank you very much for that. I myself am equally learning some new terms. These are some information that as in school you might not get them. So except you go an extra mile to learn more or to learn from a senior colleague and all of that. But what we basically learn is how to just reconcile test kit on the day of testing. Another question I have is this, right? It's true that many facilities that face stockout challenges, and most of these facilities may say that and own up to the fact that they do and reconcile their stocks, right? They don't have any problem with stock management, but they still face this challenge of shortage in their commodities that they receive. So, in your experience working in laboratories internationally, what can be the possible solution to such problem, right? You do your stock inventory very well. You collect all the data that you need in order to plan ahead of time in case there's an refugee influx or there's movement of population that may lead to a decline of tests being requested in your facility. But at the same time, you still have stock out. Maybe your supplier, how do we find a way around this particular issue and barrier?
I want to link the solution to the problems.
Yeah.
So I listed the problems then, causes of
Mhm.
stock out. So now how do you prevent it? So good forecasting. So let us have good forecasting. Let's have experts across the facility, across the community, across the state come together and do the forecasting together. So everybody brings his own idea. Just like malaria is seasonal. There are diseases, there are epidemics. So you have to advise you on certain reagent and certain commodity. Okay, we might not have epidemics of Lassa this year, or it might be high. So can we get more of this commodity? Can we get more of this? So you need to bring people on board to have good forecasting, good data, and good forecasting. Then number two, timely reporting. When you don't
Mhm.
report early, you expect a lot of out of stock. It's
Sure.
only when you report that your managers know what you have on ground, know your stock level, and know how to support you and know how to send you your commodities. Like in Nigeria, for HIV program, they do send what we call CRIF report for HIV, both lab pharmacy and lab commodity. So
Mhm.
I'm involved in reviewing the reports bi-monthly from lab scientists when they send our pharmacies. There's a pharmacy section, there's a lab section. So
Mhm.
we review and send it bi-monthly. If you don't send this timely, you cannot get your commodity timely. It's only when you send it that it will be processed and your order will be processed and you get your commodity via last mile distribution.
Mhm.
Then will also advocate for regular inventory review. So there should be regular inventory review, daily, weekly, monthly. if possible, physical count, and also reconcile with what you have in your software. So when you review your inventory time to time, you hardly miss out and you can hardly have out of stock because you are abreast of what you have on ground. You know
mm,
what you have, whether you're under stock, whether you are going low or you are going high, you know. So you can quickly take action to avoid out of stock. Then another thing you do is distribution between facilities. When you observe that you have lower stock or higher stock, you have to distribute, move from higher facility to lower facilities. What I have in low, I will ask for it. When procuring or when sending order, you should add buffer stock. Buffer stock means you add some level of this, you have delay in delivery.
mm,
So you're ordering, you have to order early, stock, use the data to justify for more because you are going to buy much. So it said the best way to prevent stock out is to identify them before they happen. So you should identify stock out before they happen. Before they
mm,
happen, there are no more stock out.
mm,
You identify your stock that is going low. Identify your stock that is about to expire. Then you take action before it happens.
yeah.
Thank you.
Wow, that is a very critical
Please go
point
ahead.
because you have some facilities that they only come to notice that their stocks are finished when they are looking for the next trip to test the next patient and they find none. So it becomes a little bit challenging to handle the rest of the patient for that day. So the point you just mentioned is very vital and critical. Thank you very much for that. So the question
Absolutely.
is on the usage of technology and innovation in order to reconcile stock in facility in contexts like remote areas. So what are some innovative ideas that maybe you have come across in the course of working with laboratories and facilities around Africa and out of Africa that these facilities can use or implement to better manage their commodities to avoid wastage and stock out?
Thank you, Kevin, for that question. Thank you. Thank
Mhm.
you. In hard to reach areas or in difficult settings, you find out that there's no infrastructure,
Yeah.
there's no power supply. That is one. They don't
Mhm.
have computers for inventory management. They have computer that, to be used to install software. So
Mhm.
all these are not available. So what do you do? So first of all, we know people who have phones. They have normal phones or Android phones.
Yeah.
So first of all, let me start with normal phones, not Android phones. They can utilize their phones by texting. At the end of the week, you carry out your inventory, you write it down, you text it to your manager that is in the city. So you
Mhm.
can see that the managers have visibility, even if not daily, he has weekly visibility of your stock level. He knows which of the commodity is going low and which is too high compared to others. So by then, decision making will be made by the two persons to
Mhm.
ensure that there's no out of stock. Text messages can be used. Facilities can send text messages to their managers at the central store to let
Mhm.
them know of their level of stock and also the level, the expiry date of each individual commodities. This can be done daily or weekly, depending. Also, we can use WhatsApp. WhatsApp can be
Mhm.
used. We can have a WhatsApp platform where all facilities are in the group. Every
Mhm.
facility will be updating us with its stock level and expiry date. It can be also weekly or daily. Then there's another thing we use also. We can use Google Sheets. You can have Google Sheets, share the link with all of them, and
Mhm.
you design it so that each facility have its own sheet. They will now update their sheet with the expiry date. You can use text messages in areas where network is bad. Text messages, facility staff can always text their managers text them their stock level and the expiry dates. And
Mhm.
also, we can utilize a WhatsApp group where we can bring all facility together in one WhatsApp group or Telegram group,
Mhm.
whereby each facility each day or each week they will now update us on what they have on the expiry date. So you can see the decision is not only for them alone. People above them can also see their data and support them in making better decision. In
Yeah.
fact, lastly, we can use Google Sheet as well. Google Sheet where we can design a Google Sheet for each facility, like a dashboard, Google Sheet dashboard with stock on hand and expiry date. So anybody can monitor it from anywhere. You
Mhm.
understand? So I can, if I see what you have on ground, the expiry date, your consumption level, I can even place you order, send you even with you without you, when you asking, I can just send you commodities.
Mhm.
So these are
Wow.
basic ways, simpler and cheaper ways we can use to monitor inventory in areas where infrastructure is actually not very good. Everybody has a cell phone. Yeah, it can either send text or it can chat, it can browse. So we can use it. In bigger settings, we have to engage a web-based or cloud-based inventory system, a
Mhm.
software. Yes. Now with the advent of AI, you don't need to even you can design a little software that you can use. That you can design inventory software
Mhm.
for certain number of facilities. And you can use it, design it based on your need. And you can
Mhm.
use it, coin it to this, and you can use it and let them download it on their phones. Use it without paying anything. So I don't want to come into software because we are discussing about hard to reach areas. Software, people need to download it and they need network to operate it sometimes.
Mhm.
So thank you very much.
Wow, thank you very much for explaining that to me. Most of these facility are usually more versed with paper documentation when it comes to inventory. They have their stock cards, they have their store
Yes.
registers and all that where they document, and they get to send a feedback or give a report to their managers when maybe they notice that there's a stock out. So these are really innovative ideas that facilities can use, especially the aspect of Google Sheet, because Google Sheet has the possibility of being used by many facilities, and the store manager has access to all those facilities and can easily monitor which facility is running out of stock to even send before even the facility requesting. So thank you very much for that particular answer and for guiding on that. So we are drawing closer to the end of the session, and we usually end our session by by giving keynote messages where a guest speaker will give keynote messages to younger professional or to professionals who are already in the field about this particular topic of inventory management and supply chain in the laboratory. What are some keynote messages that you can give to those professionals?
Yeah. Thank you for that wonderful question. My key messages, this is like, I believe this is a forum for lab scientists. Am I right?
Sure,
For
yeah,
lab
yes,
scientists.
it
My
is.
advice to young lab scientists coming up is that they should embrace inventory management, supply chain, and technology because technology is the future. They can
Mhm,
even design software that can be used in any setting to manage inventory, to
mhm,
ensure forecasting, calculation for cost forecasting, even support in procurement.
mhm,
We have e-procurement now. So let them embrace inventory management. Inventory management is not only for certain professionals; it's for everybody. And
mhm.
I can tell you that lab commodities are one of the most important commodities that are being managed in uh, uh, public health programs,
Yeah.
and they are very expensive. Billions of dollars are spent to procure lab commodities. So what is the problem if what is what would stop a lab scientist from making himself an expert in inventory management and in supply chain? And by doing that, also adding technology into it, information technology, information communication technology. Let us leverage inventory management, supply chain, ICT, and also artificial intelligence. So these are tools for the future. If you don't learn those things, you are going to be outdated. Yes. Just last week, a friend reached out to me, an organization reached out to me that I should recommend a lab scientist that
Wow.
is good in National Health Logistic Information System, NHLMIS in Nigeria. They need a national consultant
Yes.
that will support them in National Health Logistic Management Information System, a laboratory scientist. I have to
Mhm,
start thinking. Thank God I have some in my network. I have to recommend someone and send his CV.
mhm,
So you can see now we're talking about we have to start dividing inventory management into laboratory inventory management system also. Yeah. So as a lab scientist, you is compulsory for you to know inventory management and also to be conversant with supply chain, to also learn technology and also leverage AI in doing your work. So
mhm,
if you man if you master these skills that I listed now,
mhm,
I think the future is yours. You can decide the future. You can design software for us. You can help us manage our inventory. You can help us reduce waste, and help support in uninterrupted supply of commodities and avoid out of stock, and make sure that our lab we have smart laboratories across the globe. This is my key message for future lab scientists. They
Wow.
are my colleagues actually. Yeah. Thank you.
Wow. Thank you very much, Mr. Ahmed. These are very, I would say, this advice goes straight to the heart because it's always good and amazing when senior professional inspire junior professional with such amazing information, right? I've been so much fascinated about technology and how to ease the work of laboratory scientists by bringing in innovative ideas, just like some you just mentioned. And I didn't think to the extent of going into inventory, right? You mentioned it, meaning it's really needed and it will serve a greater purpose to facilitate and improve healthcare delivery in our communities. So I will say thank you on their behalf for this wonderful piece. So this should be the end. And
Thank you, laptop.
yeah, thank you. Our entire team is thanking you, and we're all honored to have you join us today for this particular session. So I believe you have come across what we have shared on LabTalk platform and equally on my personal profile, what we do. So we welcome any idea and we welcome collaboration as well. If you have maybe an activity or a project that you want us to promote or to share, we're always open to do it at no charge. And any idea that you want us to our team to work on, we're very open. So thank you very much for joining us.
Thank you. Nice meeting you. Nice
Yeah.
speaking with laptop. See you
Thank,
again.
thank
And
you
best
very
of luck.
much.